Well, good afternoon, everyone. I see some familiar faces from the last session and some new faces as well. So thank you for those that were here before. Thanks for staying. I guess that you enjoyed the first session, or you were hoping maybe there were better things to come. I don't know. Or you liked my jokes. I don't know. But, the sing, I know. I promised that. Well, at the very end. I'm leaving the best for last. Pete's going to do it. That's right. Pete's going to do dancing. Pete raps. But, and I'm not talking holiday rapping. But, so thank you for joining us. I actually have a better speaker who will take the second half. You get me the first half. I'm Lisa Lifshin. I'm the Senior Director for Pharmacy Tech Education and Training and Residency Services. Say that 12 times fast. That just means I've been there a long time at ASHP. And my partner in this is Pete Vlasses, the Executive Director at ACPE, and we have a really great collaboration for pharmacy technician accreditation, and this has been in process since 2013 when we formed the Pharmacy Technician Accreditation Commission. And this group ensures quality, and we'll tell you more about it, and I'm sure a lot of you know about it, but we like to explain it at every meeting for those that don't know about it. Ensures quality of pharmacy technician training and education, standards, regulations, anything new with that, all issues, all products developed accordingly, and really all of the hot issues which you're going to hear about, which brings us to today. And it's really exciting for me because I've been working with pharmacy technician accreditation and residency accreditation for 23 years. And before that, as a student, I started as a pharmacy technician at Thomas Jefferson University Hospital in Philadelphia, and that was the first pharmacy technician training program that was accredited. So it's dear to my heart, and worked at a kids hospital in Washington, D.C. for a long time. And if you want to know where safety really has to happen and where chaos happens in an IV room, it's at a kids hospital in Washington, D.C. So with that said, I'm going to give the first half of the presentation, and Pete will come in on the second half, and I'm sure we'll interject at certain points as well. But please feel free to ask questions. And again, thanks for joining us, and we have a lot to share with you this afternoon, and welcome to Anaheim. Thank you. So the presentation is new, ASHP, ACPE accreditation standards for educational preparation of pharmacy technicians. That's us. Okay, so the learning objectives, because Pete is the executive director of ACPE, so I don't want to leave them out, are to discuss the variation in pharmacy technician education and accreditation requirements across the United States, describe the purpose of the 2017 Pharmacy Technician Stakeholder Consensus Conference and the consensus reached regarding pharmacy technician education and training. Can everyone hear me? Is everything okay? And discuss the new 2018 standards developed in response to this conference. And January 1st, 2019 is a big date for this because they go into effect then. Everyone applying after January 1st must use the new standard. So with this, we have questions. So think about these questions in the beginning, and they'll come back in the end. So question number one, which of the following is true? I'll summarize each, and then I'll take a raise of hands to each. In the ASHP ACPE accreditation collaboration, using the same set of standards, ASHP accredits employer-based education and technician and training accreditation programs, while ACPE accredits those in community colleges. B is PTAC is composed of pharmacy tech education providers, pharmacists, techs, a state board member, a public member, and members of the ASHP ACP Board of Directors. The new standards, I'm summarizing, For the entry level, call for a minimum of 400 hours instruction divided between didactic, simulation, and experiential education. And the NABP has called for all state boards to adopt the revised ASHP, ACPE, pharmacy tech education and training accreditation standards for entry to practice. Which one of the following is true? Is it A, B, C, or D? Which do you think? Well, I'll give you the chance to think about it during the presentation, and we'll come back to it. Okay, assessment question number 2. Think about this as the presentation continues. Which of the following is true? Distance education programs for the education and training of pharmacy technicians do not qualify for ASHP, ACPE accreditation. B, the new standard address both the accreditation requirements for entry level and advanced level pharmacy technician education and training. C, the NAB Model Practice Act defines the scope of practice for entry-level and advanced-level pharmacy technician education and training. And D, high school-based pharmacy technician education and training programs do not qualify for ASHP, ACPE accreditation. All right, again, think about this as the session goes. What did I do? Okay. And this is the last of the questions. How many degree options existed in 1930 to become a licensed pharmacist in the U.S.? 1, 2, 5, 7, 11, none of the above. Okay. And this next question is not of the one you're answering, but ponder this one. What does this ketchup bottle have to do with pharmacy technician education today? Now look at the label very carefully. All right, I'll help you. There's 57 varieties. And when you look at pharmacy technician education today and training and regulations, there are about 57. There's 50 states and about 7 territories and districts, and they're all different and they're all the same. And there's 57 varieties of tomatoes. So if you look at each state and territory as a tomato and all different, that's pretty much what we're seeing today. And wouldn't it be nice to see them all on the same vine? So this is what we see today. So keep this in mind in the beginning of the presentation as well. Currently, there's various points of entry for pharmacy technicians, but they're not always together in unison in each of the states. There are, for board regulations, some have registration. Some states require board regulation, like registration, licensure, or certification in that state. Some states have on-the-job training, retail or hospital-based training, whereas some states require the PTCB exam or the accept exam, a national exam or a state exam, and some require formal education, such as programmatically accredited, like the ASHP, ACPE accredited programs, or non-accredited programs. There's various types of pharmacy technician education and training programs right now, certificate and degree programs in community colleges or technical schools, College of Pharmacy associated programs. There are a few that are ASHP and ACPE accredited now, employer-sponsored programs, high school, there's a few in Florida, military training like in San Antonio, certification review courses, and distance learning programs. And there are a few that are ASHP, ACPE accredited distance learning programs, and many that aren't as well. The Pharmacy Tech Accreditation Commission, as I mentioned, was formed in 2013, and ASHP has been accrediting programs. We had developed standards in the 70s, and the first program was accredited in 1983. In 2012, the NABP requested for ACPE to look at participating in pharmacy technician education and training and the accreditation of this, and they did a very thorough analysis of this and looked at the ASHP accreditation process and saw that there was a process already. We had been doing this for, as I mentioned, over 20 years, but the public really didn't embrace it to the degree. We had, at that point, probably about 90 accredited programs, but the public, much of the stakeholders out there really looked at it as a hospital-based accreditation, even though community colleges were accredited, military programs, a few proprietary here and there, a few hospital-based programs here and there, but didn't really look at it as a global program. The boards of pharmacy didn't really recognize it to the degree that they could. But really, if we formed a collaboration or an alliance, together, we could certainly capture more territories and, as Pete says, get everybody under the tent. So PTAC, the Pharmacy Tech Accreditation Commission, was formed through the ASHP ACPE collaboration in 2013. So this is relatively new. We had formed at ASHP, it was a time where about every 6 years, it's a lot more frequent now, we would look at our standards and regulations and guidelines and review them for the next iteration. And at this point, we had looked at and developed procedures for the PTAC. So the ACPE Board of Directors looked at them and approved them, and so we were ready to go. So the PTAC recommendations, it was decided that anything that was voted to recommend to the Board of Directors, because everything that, for instance, we have a commission on credentialing at ASHP for our residency programs, and they also used to, in the past, review everything for the pharmacy tech programs as well, have to go to ASHP. So everything that goes through the PTAC also now has to require approval from both ASHP and ACPE. So the first group of those recommendations went to, we had our May 2015 meeting for PTAC and went to the June 2015 meetings, the ASHP, ACPE Board of Directors. And then all the programs found out in July of 2015, all of the actions and all the voted actions from those meetings. The current PTAC members are the following. We have a really wide representation. Our chair is from Indiana. She works at IU Health, and she's also on the Indiana Board of Pharmacy. Barb Locker just retired from North Dakota, a pharmacy tech program in North Dakota. North Dakota was the first state to mandate that pharmacy technicians, to be a pharmacy technician, they must complete an ASHP, ACPE accredited pharmacy tech program. John Smith is has a really extensive experience in the pharmacy tech world. He's an educator. He's got a doctorate in education. He works in the school system in California, which has, the regional systems, and he held a position in quality and accreditation for the Corinthian systems back then, and also in a proprietary school prior to that in California, and a variety of other individuals, directors of pharmacy. We have a public member. We have the president from ACPE of their board, and the president-elect of the ASHP board. And I sit as the secretary of the group. So this group, we met in October, and all our minutes are ready now to go to the ASHP board and to the ACPE board. So the final drafts are coming through before I left. So that's getting ready. So we had a stakeholders consensus conference on February from February 13th through the 15th in 2017. So why did this happen? Why now? Well, there were a variety of reasons why it should happen. It was the time, right? The technician role is evolving and the scope of practice is expanding. We really need technicians to play more, they play more integral roles in supporting pharmacists in all practice settings. We want to really engage and have provider status happen. And for provider status to happen for pharmacists, it's not going to work without pharmacy technicians. And for collaborative healthcare, the complexity and complications is there, and that equals collaborative healthcare. There's greater expectations for technicians, not just for the technicians, but for patient focus and for safety. And on-the-job training just can't really cut all of that. Regulations governing technician entry and practice vary widely. Remember the Heinz ketchup bottle. And consider standards necessary within the profession to meet the demands of the growing healthcare system. And I think you'll really, the next slide will really catch your interest. Pharmacy is the only allied healthcare profession without national standards for support staff preparation. Look at this, the clinical lab technician, 2 to 4 years of training. Dietetic technician, 3 to 4 years. No drug handling, right? Medical assistant, 1 to 2 years. Surgical tech, 1 to 2 years. Vet tech, 2 years. We don't have this listed, but a hairdresser, 1,000 hours and more. We could go on and on with this. So right now, when we start talking, Pete's going to talk about the standard later. The standard that we do have now is that for an entry level, 400 hours equaling greater than or equal to 8 weeks, and advanced level, 600 hours greater or equal to 15 weeks. And look at all of these other healthcare professions, something to really, really think about. So this conference, it was planned by PTCB, ASHP, and ACPE with a multi-stakeholder advisory group. There were health system pharmacists, community pharmacists, representation from all of the different pharmacy organizations, those that start with A, those that start with N, boards of pharmacy, different state boards of pharmacy, and it was sponsored by PTCB. As I mentioned, I was off a day. It was the 14th through the 16th. In Irving, Texas. There were 89 invited participants, and we also provided the opportunity for anyone to participate virtually. There were about 350 people that participated remotely. And as I mentioned, there were just all types of pharmacists and pharmacy technicians involved in this conference. So there were plenary sessions, there were breakout sessions, there were sessions where discussions occurred regarding certain aspects, where there were brainstorming, and there were opportunities to vote, obviously, to get consensus. And the recommendations after all of this from the Stakeholders Conference included the following: defining pharmacy technicians, the role and what pharmacy technician education is, requiring knowledge, skills, and abilities of entry-level pharmacy technicians. That was one of the biggest things. Certification of pharmacy techs, looking at the state laws and regulations and of pharmacy technicians, the role and looking at advanced pharmacy technician practice, and moving forward on pharmacy technician issues. There was general agreement that pharmacy's immediate priority for technicians should be the development of standards related to entry-level pharmacy practice, and that advanced roles for pharmacy technicians will evolve over time. Well, we felt from the standard aspects that we should tackle this. Not necessarily that everyone should go through advanced training, but it should be available, because much of our programs that are accredited do offer the opportunity for advanced training, and why should we really leave them out? Because it's there, and there are advanced practice settings that our stakeholders need these trained individuals. Education of pharmacy technicians. Most conferees agree that national standards should guide technician education, and the technician education program should be accredited. So as you look at the pie, 71% agreed, strongly agreed, 26% agreed, and there's a very small percentage, 3% disagreed. So when you look at the number, 3% out of 89 is what, like one person, I guess? One and a half people, maybe? 2 people? So moving forward, there was a unanimous agreement that the conference plan should establish a coalition of stakeholders to pursue the consensus recommendations from the conference, and that participants should have in this event should have responsibility to work towards achieving the consensus recommendations. And with that, we've utilized the group, the advisory group, and more, and we've met 2 additional times since then to meet on a variety of issues related to this to advance, and not to just sit on these issues, to continue moving forward, and Pete will talk more about that as well. So the first thing we did was since there was a need and there was consensus on developing an entry-level standard, the PTAC at their May 2017 meeting developed a vote to recommend to the ASHP and ACPE Board of Directors to support the writing of a new standard to have for an entry-level pharmacy technician, which, for those of you that have ever been involved in writing a standard, it's a big deal. And it was to be written now. They wanted the group to get together in August of 2017 and write it, which really should have constituted about, in the support, 6 hair colorings for me. But it didn't, which was, sad. But all levity aside, there was a standards writing committee formed, and this is the group, and Pete is now going to talk about the standards at this point, but it was a very rapid process, and he'll tell you a little bit about that, and very successful.
Good afternoon. Good afternoon. So that one slide that talked about how many different degree options in 1930, what's the right answer for that? 1? How about 0? How about 5? How about the right answer is 11? There were 11 different degree options across the United States to become a pharmacist, and they ranged from 1 year, and there was actually a 6-year PharmD at the time. And you can imagine the chaos, right, about people leaving one state, going to another state. The military was saying, how do we grade these people when they come into the military, and how do we know what to pay them? So at that point in time, there was a call that came out from the APHA, the ACP, so we had the practitioners, the educators, and NABP, the regulators, to form ACPE to create quality assured standards and to define what the entry-level degree should be. And we chose at that time the 4-year baccalaureate degree was the standard that we first started with. That evolved over time to the choice of a 5-year baccalaureate or an entry-level PharmD, depending on the state. So we went from 11 to 1 to 2, and then in 2000 we converted to the all PharmD as the entry level. And we now have, I think at this point in time, the majority of the pharmacists that are licensed are PharmD trained at this point. We've kind of gone through that process. So, so we had a lot of experience. I've been there, this is my 20th year. I've been through the implementation of Standards 2000, the writing of Standards 2007, and now the Standards 2016, the new ones. So the beauty of the collaboration was we could bring all the ACPE history, experience, all that kind of stuff, and then get into a collaboration, because we both care a lot about pharmacy technicians being trained at an entry level at least in some standardized way. So we organized this writing team, and you can't have a huge writing team. You just can't do it. You have to have a small group of people start something, and then you have to have it reviewed by more people, and then you have to have it reviewed by more people. So we chose in this case to use people on the PTAC, and some of them you'll recognize from the previous slides, And then